Tell me what is your name, Kate, and your title?
I am Kate Orville. I'm the co-director of the Washington State Medical Home Partnerships Project for Children and Youth with Special Needs. It's based at the University of Washington and funded by the State Department of Health.
What got you involved with that work?
I got involved originally because I was interested in maternal and child health issues and cross-cultural issues, and then I ended up having 2 kids who have special needs. So it's been a really rewarding overlap of professional and personal interests at this point.
What are some of the efforts that Medical Home Project has pursued in addressing the needs of children with special health care needs?
Well, a lot of our work has to do with this concept of medical home, which is where a person, a child in this case, has a primary care provider who partners with the child and their family and helps them access all the services they need and figure out with their primary care, and if they need special services, helps them get that. So as you can imagine, for children with autism and their families, this would be a really important piece of health care for this family.
What are some ways in which an approach like that... Before you answer, hold on 1 second.
Okay.
What are some ways an approach like that would benefit, in this case, children with autism and their families?
Well, you think about how if before you have a diagnosis, you just have a lot of uncertainty, and a parent will typically be the first one who will have concerns about how their child is developing, and then where do you go to get answers? And so hopefully your pediatrician or family medicine doctor, nurse practitioner can help you figure out whether there are concerns and how to address them and how to get additional evaluation to figure out what your issues are and how to get you the right help.
How do you think that the practice of medicine around children with special needs has evolved much in the last 5 to 10 years?
I think it has. I do work with pediatric residents at the University of Washington. I do some training around medical home and resources for those families. And when I talk sometimes about, how you talk with the family or about care coordination or, other things, the residents just say, well, of course. So I think there's a different expectation for people going into primary care in pediatrics now. It's less about I'm the expert and I'm going to help you, and more how do I work with the team, with the family, with the care coordinator, the nurses, outside community partners to help my families.
Do you think the same is true for children with autism? And do you think there's anything, what jumps out for you in providing health care for children with autism?
Well, I think that physicians and other primary health care providers have. Should I just stop for a second?
Yeah.
Okay, I'll just
stop.
Yeah,
Sorry.
That's okay.
Changes or helps children with autism and their families?
Well, I think it can be really scary to be a family who has a child where you don't know what's going on, or even if you have a label that you need help and you don't know. I'm sorry, I'm distracted. Can we start over again? Sorry.
Yeah.
Okay.
I didn't ask the question very well anyway.
Well, I mean, originally you were asking more about whether they were trained, knew about, which I could address.
You gave a general response about how the Medical Home Project helps provide a different kind of care to children with special health care needs. I'm trying to get at, how does the Medical Home Project specifically help children with autism?
Oh, so the project, not medical home.
Oh.
I'm just not sure which, because originally you were asking about the home, and now, I mean, and I can do either, but they're two different things.
Right. Okay, so that's two questions then. So my first question will be, how does practicing a medical home model help more specifically children with autism and their families? And I do believe you were on the right track when you were saying, you know, in the case of children with autism, a lot of times the label itself doesn't really identify what needs to be done, what resources are there, you know what I mean?
Yeah.
It's a spectrum diagnosis, so I did like where you were going with that. And then I might additionally ask how the Medical Home Project has been sensitive to that population in its work.
Okay.
So first, how does Medical Home help or support improved service provision for children with autism?
Okay. Well, I think a key piece of the patient-centered medical home is really shared decision-making and the engagement of patients and families. And with autism, there isn't one right approach. I mean, there are a variety of ways we know that can help, but you really need a trusting partnership with your primary care provider and team to be able to talk about your options. And I know for a lot of families, too, there are alternative treatments they're interested in and may want to bring up. And if you trust your primary care provider, you can bring those questions and discuss as equal partners with getting medical advice, and you talking about what the values and hopes and goals of your family and child are. And if your child's old enough, they're obviously involved in that. But you really need that trust to talk about things that are sensitive and that people may worry that they'll be judged for. And so anyway, so I think that trusting relationship is really important, particularly if families who have children with autism, they may be experiencing negative reactions when they're in the grocery store or from the child's teachers or someone. And so they need a strong partner and advocate for figuring out how best to help their child grow into, the full person they are and can be.
And how do you think the Medical Home Project has specifically incorporated the population of autism in its efforts?
Well, we were really lucky starting in 2009 to be working the University of Washington and the Department of Health and communities including Spokane, looking at there's such a long delay to get a diagnosis of autism, and communities, particularly rural communities, were talking about how, they'd have to drive for hours to go to Seattle Children's, or maybe there was an individual provider in Spokane that they could go to, and long wait lists, and meanwhile their child's getting older, not getting help, they don't know what's going on. Meanwhile, the physicians and psychologists and clinicians at the several multidisciplinary diagnostic centers in the state were frustrated because they saw their wait lists growing, and they felt terrible because it was like the sea was rising, and no matter how hard they worked, they couldn't help. So together, these clinical experts and communities, so individual providers, public health, Northwest Autism Center, other groups came together in several summits over several years and came up with this process called community asset mapping, which is where you identify at least one, but preferably several key advocates in a community who really want to see what can the community do locally to do more of the work of screening and evaluation for children locally. So starting with Lewis County and then spreading to other communities in the state, community providers, including pediatricians and other healthcare providers, but also the schools, because you have speech and language therapists, you have occupational therapists, you have really good educators, you have school psychologists. Even rural communities have really great resources that they may not think of when they're thinking just their purely healthcare setting. So those providers, together with families, individual families and family organizations, and early intervention, parent-to-parent support, other people came together, and with the support of this coalition, looked at what do we already have in our community, and can we sort of create can we create a more efficient system so that we can figure out who really has autism? Because they realized like about a third of the kids that got sent to places like Seattle Children's or Mary Bridge didn't really have autism. They had something else, so they still needed help. But after they'd waited for a year or two for a diagnosis, they were told, no, you don't have autism, which doesn't put you any further ahead. In the meantime, kids who had autism couldn't get into the line. And so thinking like, could we do more screening so we have better information and we could pull the information from early intervention from the schools and train local pediatricians and other health people to look at, does this child probably have autism or not? And if they do, and they got additional training, then they could even do an evaluation and diagnosis locally, which the healthcare authority, which is Medicaid in our state, has been providing some training for as well. But if it was not clear, because even for the state and national experts, there's a certain number of kids, and I don't even know how much it's at least a third, that they have disagreements about what's going on with that child. And so it made much more sense that if you had a child that it wasn't really clear what was going on, that you brought together that local information from the people who know that child, and then you share that information with a trusted referral at one of the larger multidisciplinary sites.
Has the community asset mapping project, do you think, helped mitigate the wait lists at the larger multidisciplinary team centers?
I don't know that it's actually helped because there's still so many kids who need to be evaluated for autism. And so, but what it has helped is that for children in the communities who are doing this, they are getting faster diagnoses.
So how could someone who wants to be a beacon in their own community for community asset mapping, how might they contact someone to get involved with that?
Well, there are a variety of ways. They could get in touch. Obviously, you have Northwest Autism Center here, but if they go to medicalhome.org, that's our project website, and there is an email there that, for the website, they can just email, or that would probably be the easiest way.
If they showed an interest in
yes.
asset mapping for their own county,
yes.
they could contact you?
Yes, they could contact me.
Okay.
At the Medical Home Partnerships Project at the University of Washington, their local health department, the Children with Special Health Care Needs Coordinator, might also have information, but probably the most direct is to go to our project. I don't know if that's the best.
Is there anything else you'd like us to know?
I just want to say this has been some of the most joyful work. I know that, and as a parent who has, experienced health challenges or developmental challenges in our family, it can be really scary. And I think it's scary not just for families until they find a community, but it's also really scary for the healthcare providers and the schools. And people feel so alone and want to help, and they're desperate to help, but feel often overwhelmed. And so sometimes, like, if you feel like you're doing a bad job at something, you'd rather just not do that job. And so I think what has been so gratifying about this work is that families who have children with autism are really passionate. They really want to make a difference. And the providers who want to help, once they know who their helpmates are, they really want to make a difference. And there's a lot of joy in this work. So.
Perfect. Thank you so much, Kate.
Okay. Thank you.